Good evening, ladies and gentlemen, and welcome to this Carmat web conference on the occasion of the company's half-year results. It will be structured as usual in two parts. First, a management presentation given by the team led by Stéphane Pia, and afterwards you'll be able to ask your questions. You can ask them in written through the chat system at the bottom of your screen. I now hand over to Stéphane Pia. Sir, please go ahead.
Thank you. Good evening, everybody, and thanks for joining this evening. So today we'll speak about the activity of the company in the first semester of the year and give some business update. So all together with me, I have Pascal, who is the Chief Financial Officer, Francisco Ricci, responsible for the development of the therapy, and Dr. Piet Janssen, the CMO of the company. So what are the progress made over the first semester of the year? So as a reminder, so the mission of the company is still to solve the shortage of human organs in the world. As you know, advanced heart failure better is the first cause of death around the world, and our vision is to become the primary alternative to heart transplant. So very quickly, what we achieved since the inception of the company in 2008. So I know for everybody, it's developing a medtech implant looks very long, and it is, but we believe at Carmat that we've been progressing consistently and quite quickly compared to all the other projects. As a reminder, in 2008, we were 5 companies on the starting line, and 2 went bankrupt, and the 2 other ones are still implanting in animals. And in the meantime, we've been able to initiate a first in man. We've been able to build a manufacturing facility. We got the CE mark for bridge transplant. We started commercial very briefly in 2021. We experienced some quality issue, and we decided to voluntarily suspend the implants. And now we are back this year, and we've been restoring the manufacturing capacity. So we outperformed clearly all the competitive projects to date. So we are ready now for takeoff. We are not a simple startup at the stage we are today. We are a fully fledged organization. We have all the function in-house. So we have a quality assurance in-house, we have regulatory affairs, we have clinical, we have manufacturing, we have R&D, and we have finance, administration, HR, and last but not least, commercial. So we are a complete organization ready for takeoff. So where we are today between clinical and commercial, we prepared more than 40 centers ready to implant. We've been working all the summer to build a backlog of patients, fueling sales momentum for the last part of the year. And we've been expanding beyond the first targets, which were Italy, France, and Germany. Advanced heart failure is probably one of the most important diseases, growing very fast on our aging population worldwide. As you probably know, the number of transplants is limited to 5,000–6,000 a year between US and Europe, and more than 200,000 people are diagnosed with advanced heart failure every year. Unfortunately, only 3% of them will be able to get a heart transplant, and most of the rest will die within a year. ESON is a pretty unique solution for an unmet need. Our profile is very unique. So we have acquired hemocompatibility that require very low intensity anticoagulation. We have a physiological flow, silent operation, and last but not least, it's activity-based output variation. So we are the only device able to change the flow, real time according to the level of exercise of patient, which make an unparalleled safety profile and a superior quality of life. I will hand over right now to Pete Janssen, our CMO, who will tell you what we achieved so far in terms of clinical outcome and what was our experience after the restart.
Yes, good evening, everyone. Thank you, Stefan. So here we show the 4 requirements that are essential for physiological heart replacement therapy and how these are met by the ACE artificial heart compared to the other existing therapies. So physiological replacement can only be achieved if all of these characteristics are present in a single product, which is the case for the ACE device, as you can see on the graphic. So thanks to this acquired hemocompatibility, we have not observed any cerebrovascular accidents and gastrointestinal bleedings in our patients. And unlike the experience with the LVADs, ACE patients have not had chronic infections at the percutaneous driveline exit site in our current experience. So since the restart in November 2022, 7 patients at 5 hospitals have been treated with the ACE device. And with the increasing experience of the teams, there's also a growing confidence in the performance of the device, which had made it possible to also treat sicker patients while maintaining a consistent safety profile in these cases. As in our overall experience, the success of the procedure remains 100%, with a survival rate of 83% at 30 days in this small cohort of 7 cases. 3 out of the 7 patients were transplanted, and in all cases, the procedure was successful. And last but not least, no device failures occurred in this cohort. Our total experience constitutes 38 patients implanted with the ACE heart. The longest support duration is 25 months, and 13 patients have received a donor heart. The total clinical experience approaches almost 17 patient years. The objective of the French EFICAS study is to evaluate the safety, effectiveness, and cost of care of the ACE artificial heart as a bridge to transplantation. We began recruiting patients for the study in Q4 of 2022, and we expect to complete the enrollment in 2025 for a total of 52 patients implanted with the device. In addition to the 6 hospitals shown on the chart here, we intend to open at least 4 additional centers in the coming months to further expand recruitment. And in addition to the safety and performance data that we will accrue, the results will also include socio-economic data that will help us obtain reimbursement for the product in France. And finally, the study will also be used to support our efforts in the United States, as I will explain in the next slide. So the US feasibility study can be seen as a gateway to commercial approval in the United States. Since the design and conduct of the early feasibility study and the EFICAS study are very similar and encompass the same patient population, it is our intention to employ the results of this EFICAS study in our request for access to the American market, which is planned for 2026.
Thank you, Pete. So I will speak about manufacturing updates. So when you develop a new device, a new cardiac implant, you have 2 questions to solve. The first one is clinical, and I believe we've been doing a great job regarding clinical outcome with our device. And the second one, which is probably one of the most difficult tasks, it is to move from prototyping to manufacturing. And as most of the product developed so far, we've been experiencing the same learning curve. We learned the hard way. We moved from ramping up to first problems, to resolve these problems, and getting back to manufacturing. So in a nutshell, what we've been doing is that we resolved the supply issues the first part of the year. It took a bit longer than expected. If you remember, for people who followed the January call, our goal was to replenish gradually the supply chain, but unfortunately it's been a bit longer than expected, and we could restart to build a significant inventory in June only. So summer has been a time for a higher ramp up, and as we speak, we have close to 30 devices on the shelf, and we finally managed these months to go beyond the 10 products a month. So I would say that now we're able to accompany the implants coming next quarter. So manufacturing expansion is on track. So as you will remember, we have, as of today, a capacity at full speed of 250 devices a year. As we anticipate for the coming years, a fast growth, we are working as we speak to expand our facilities. So here you see the business park where we are based, close to Paris. So we started our history in BDA 1, which was the first building. And as we speak, we're expanding to BDA 2, and it should be finished by the end of the year. So BDA 1 will become mostly a clean room, and BDA 2 where will be the place where we assemble the product. And we should get to a capacity of 500 devices by the end of the year. And then you see on the right side of the picture, a new building called BDA 3, where we plan for the future to build a huge clean room to be able to move up to 1,000 devices. Interestingly enough, is 500 devices will roughly take us to 100 million euro as a first stage. And once we get close to that stage, we probably trigger all the work to build a clean room in BDA 3. Commercial development. So I think that's probably the most important piece of our work as we speak. So in the last 5 to 6 years, we've been working on evidence-based medicine with clinical. We've been working as well to start to build a manufacturing site on build processes in order to build inventory. And now we are really entering in the commercial phase. So I will hand over to Francesco, who will explain in more detail how we are facing the market.
Thank you, Stefan, and good evening. This slide is very important because it allows us to explain the route to implants, and each restart is never off-on process. It implies certain steps, and each step can have a different duration according to the country, the hospital, where we want to achieve implants. The first step is communication to customers about the availability of the product. Then hospitals start the screening process, which may be a little complex as it requires consensus on a particular patient from the heart team. So as you know, every patient is discussed nowadays in heart teams, and only if everyone agrees on the potential, let's say on the fact that a patient could benefit from a certain therapy, then the patient is referred to that therapy. So once the patient is referred, our experts together with the clinicians evaluate the patient, and only when it is confirmed that the actual implant planning phase starts. So what we did since June is the following, and it's important to highlight that we started really our implant generation process in June, when we had, let's say, enough level of stocks at manufacturing. So since June, the field has started engaging customers to generate demand. Hospitals have started the screening process, which resulted in a backlog of patients. Some of these patients have been confirmed for implants. So they have been discussed by our experts and the clinicians at the hospitals. And then, you know, the implants, already said, then the implant phase, planning phase has started. So from June until now, Carmat has been pursuing its efforts in terms of training of medical teams, has been supporting hospitals for therapy funding, and has taken advantage of the first part of the year to reinforce the field team. And I'm referring to the surgical proctors, the field therapy specialists, as well as the commercial team. So what does this mean in terms of numbers? So we have received, since June, once again, more than 50 patients. So these 50 patients, more than 50 patients have been referred to us. We have collected 25 CT scans that, as you know, they're important to assess the eligibility of the patients for the implants. And we have approved 20 patients for implant. So some of these patients have been implanted, some of them are in the implanting phase. And to give you some figures about what is about to happen, what is happening lately. So we have 2 cases planned this week. We are working with some of our customers to plan cases next week on already identified individuals, and we already have a patient planned in 2 weeks. So this is the momentum that we have been experiencing. So we are really, let's say, seeing all the results of the work that started in summer. So we have 25 hospitals trained for commercial implants. We have a brand new experienced Carmat team in place. So we have everything which is needed now in order to achieve our sales objectives by the end of the year. Sales momentum will be further supported by hospitals activation. So we have the 25 hospitals already trained, but you know, the goal that we gave to ourselves at the beginning of the year was 30. So we have 4 hospitals already booked for trainings in Q4. We are planning some other initial trainings. So we are pretty confident about, let's say, achieving these results. And we have been also working on market expansion. As you know, we are active in Germany and Italy, but we are also now in the phase of activating some other countries. So we are talking about Greece, Switzerland, Austria, Israel, for example, where the product is already approved. So we believe that we have here, let's say, the right platform in order to achieve our results, sales results, short term, but also long term. So now it's time for the finance update. So I will hand it over to Pascal. Thank you.
Yes, good afternoon. So in terms of finance, let's have a look at the P&L first. As you would expect, the P&L reflects our activity in the first half of the year. So we had, as Francesco said, limited sales. 3 devices were sold in the period. because we started engaging the customer quite late because we didn't have enough devices on shelf. Meanwhile, we've tried to control expenses very tightly, and you'd see that the level of expenses was pretty similar in 23 than in 22 for the first part of the year. As you would know now, we do have some interest associated with bank loans. We've got 2 loans. One we took back in 18, the EIB, from the EIB, 30 million. And we also have 2 additional state-guaranteed loans, 10 million in total, that we picked during the COVID period. At the same time, we continue a strong investment in R&D, and most of the R&D activity is based in France. So we do benefit from a research tax credit of 1 million in the period. So net, we had a loss of about 26 million, which is broadly similar to the loss we had last year for the same period. Obviously, what's even more important for a company like ours is cash. You'd see that the cash burn from operations and investment was pretty stable versus last year, about 5.5 million a month. You will note that, you know, CapEx have picked up a little bit, and this is obviously connected to the manufacturing expansion that we are currently doing. That's for the business, so to speak. And in terms of financing, during the period, we got a blended financing from the French states under the so-called Plan Santé 2030 or 2030 healthcare plan. That's a total financing of 13 million euros. Which is split into 4 tranches, and we got the first tranche in the first half of 2023. So out of the 4.7 million financing that you see on the screen, I mean 3.3 come from this financing that we got from the French state. All the financing we got during the period is non-dilutive. So we ended up the period with a cash position of 24 million, giving us a cash runway until end of October this year. And the net debt was 33 million as well. So in terms of financial strategy, I think it's we are at a crucial time where, you know, we do expect a strong sales momentum going forward, so starting in Q4. We'll combine that with a very drastic cost reduction, which is really important to sort of get some traction in terms of financing. And in parallel, the second pillar of the financial architecture, if you will, is really financial discipline. So we'll be very strict in terms of resource allocation and operational excellence, so that every sort of penny which is spent and invested in the business is worth spending and directed towards value creation for the company. So with these 2 pillars, we will definitely go towards profitable growth as quickly as we can. Now, obviously, with a cash runway of until end of October, you'd expect that we will, you know, have to identify some funding, and we are working very actively to extend this cash runway in the very short term. So you should expect something here very shortly, and going forward, because we'll still need to, you know, raise money for a couple of years, we'll look at both dilutive and non-dilutive financing, as we said back in January. And now I will hand over to Stéphane again. I will just say before that we get very strong support from our reference shareholders. So, you know, the main shareholders are Matra Airbus Groups, Matra Défense, and 3 family offices, which are very loyal and have been supporting us for quite a while, and will continue to do so. So, Stéphane.
Thank you, Pascal. So before we move to a Q&A section, I will just finish with the outlook. So, well, just as a reminder, well, the market population, addressable market is pretty big, as you know. Our technology so far is one of the most promising under development, and obviously manufacturing scale-up is really what will be one of our main focus for the future, because we anticipate a strong demand. So we are set for growth. So I think from a product standpoint, well, clinical results were quite impressive so far, and it looks like we've been working quite well on quality, and we didn't experience any bad results so far. Manufacturing is ramping up. Obviously, we should not forget we are a new company, so it takes time, but we believe now the level of process is very satisfying. Obviously, we started manufacturing, we built a facility in 2018 only, we should remind that, and I think that's incredible progress we've been able to make over the last 5 years, and now we are commercial ready, and we are, as usual, when you launch a new implant, where we are learning, and clearly times have changed, and it's pretty slow to introduce a new therapy, which is so disruptive as our product in hospitals nowadays. So sales forecast, well, we'll do our best to meet at least the 4 million, and we expect, as Francisco said, a strong momentum in Q4. Well, the strategic roadmap, so the midterm objectives, our goal is to prepare for 1,000 devices per annum by 2027. As I showed earlier, the facility is there, so just about tracking sales progress, and at the right time, it is about hiring the right amount of people and buy the machines and build a larger clean room. We keep on working on financing reimbursement in key geographies. Obviously, the price is what it is, and we don't expect price increase or price decrease. So our way to break even will be a drastic reduction of cost of goods sold. That will pass through a strengthening of manufacturing supplier, and we are still aiming for a PMA submission by 2026. Long-term objectives, well, our goal is still to be a frontline treatment for heart replacement. Obviously, we will work actively to make sure we can evolve and move the indication from breakthrough transplant to destination. Our vision is to have a Carmat as a mainstream treatment, like it is the case for CRT today. And obviously that means that we need to change the technology all the time. On a cable-less device is clearly one of the major progress we could bring to the market. Maybe earlier, as you know, we really generate billions of data points every week, and today the only way to get access to it, it's really to retrieve the SD card in the controller, and the solution is already ready. It's about financing, but we want to have real-time data monitoring to optimize patient treatment, and we want to increase the worldwide footprint to build a multi-billion market cap company. So the ultimate objective is to become the first arterial heart approved for destination therapy. So thank you very much, and I will answer a few questions if there are some in the queue. So I have a question from the US, so a couple of questions. So the pricing is very transparent. The price in Europe is one, and it's really what we apply when I was at Abbott with MitraClip, so it's one price. So it's 205,000 euro across Europe. And so one of the 7 of the restart less the 3 in Q8, so it's green in Q4. Yes, it's right. If H2 implants are in 1525 range, what could be 2024? That's a pretty good question. So obviously we are waiting for the end of the year to build a forecast for next year, even if we already have a plan in mind. But we need to use the actual Q4 to build a more precise plan if possible, because as you know, when you launch a new technology, it's exponential and it's very hard to predict. And to be honest, I never worked on a new technology which we managed to predict precisely. So what I know, based on my experience, is that it takes always longer to get to the inflection point. But on the other side of the coin is when you pass the inflection point, it's usually going faster than you expect. So I think the real question is, when do you think you get to the inflection point? And I believe we are getting closer to the inflection point as we speak. So numbers for 2024, 50, 100, 150 implants. As we speak, we would think much more about 100 plus implants, but more to say in January. On behalf of, so it's another analyst, when do you expect the FDA to allow to resume early feasibility study? So, well, it's been very long discussions, and I will pause there, and I won't give personal point of view, but I think that as we speak, we are a tiny company, and as we said, and as Pascal said, what we will do right now is to move from a growth financing strategy to a quick path to profitability. You know, things are longer than expected. The harsh reality over the last 10 to 15 years is that the world has changed. Doctors are not as, I would say, engaged as they used to be. I mean, honestly speaking, it would take longer today to have a stent on the market. It would take longer to have valves. It is what it is. Things have changed, people have changed. It's true for competent authorities. So that's the reason why we decided to be more real and to use the money to build a path to profitability before thinking about a huge expansion. So what does it mean concretely? It means that we will do what we need to do to resume EFS. So I mean, we won't resume EFS this year, probably. We were not pushing with centers. I think we want to respect the FDA timing. So we expect to restart next year. We will build more evidence. And efficacy, so efficacy is starting now. So we have 6 centers. We will extend to 10 centers, and we will treat 2 patients this week. So it looks like the momentum with efficacy is starting now. We really restarted, as we tried to explain. Hopefully it's been understood. We've been able to start to build inventory in June only because of supply. So we've been starting to promote the restart of efficacy on commercial really this summer. And I'm happy to see that the patients are coming now. So the status of efficacy is that our goal is to complete the enrollment still mid-2025, to have the read of the data end of 2025, early 2026. Probably the change in the strategy is that instead of building a lot of evidence in the US, we'll try to discuss with the FDA to piggyback on the huge European experience we will build in the meantime. How much time does it take from searching a patient to implanting Aeson? That's probably something we estimated when we restarted. It takes, I would say, between 3 to 4 months to start a center, identify a patient, and find room in the planning of the implanting center. It's, you know, we have a patient tomorrow, we have a patient the day after tomorrow, and it took more than 1 month to get them from selection to the OR. So obviously there are many different reasons for this. You know, you need to convince all the R team, and once you get there, everybody needs to confirm, and then you need to find room in the planning. So I would say between 3 to 4 months. We hope and we believe that once we break the ice with the first patient in the center, we can treat new patients quicker. Which are the barriers you will face that prevent you from selling 500 ARTs in 2024? Well, I think that's simply what I call the market. So it's not us. Even if I don't think we are able to get suppliers to help us to go to 500 by the end of next year. But I think it's really about the time it takes to get all the centers treating more patients in a year. So now from a math standpoint, if we have 10 centers next year in France, we will start in FS, and we have 30 centers commercially, but let's focus now on France and commercial. So let's assume we have 40 centers at the end of the year. So 40 centers, it would mean to get to 500, 1 patient a month per center, which is unrealistic next year. I think back of the envelope calculation for next year, we would think much more about between 2 to 4 patients a center. So if you run the math, 2 to 4 a center, so it's at least 100 plus to potentially 150, a bit more. So that's the time it takes to get the therapy full speed. When can activate the program in Lebanon? So that's a good question. We are a pretty small company, and we've been working with the distributor there. I know he's frustrated. We are as well, so we need to pick up or choose our battles. And I'm hopeful that we can activate the program very soon. So, you know, the distributor, if he comes with a patient, we'll do all what we can to treat it as soon as we can. But you know, the world is made of promises, right? And we can't afford anymore to follow all promises. And we got promised with a lot of patients everywhere, starting in France and Germany and Italy. So, you know, we'll focus on main countries today, and but you know, Lebanon, Israel, other countries. If we have a patient which is real, we'll make all what we can to do it as quick as we can, because we need to treat patients. But we are open. Are you not quite behind in announcing financing if you have only cash runway about a month? Well, you know, I don't know where you are based. You're probably not based out of France. Unfortunately, it's a matter of fact that in healthcare, the company in France are really waiting for the last minute to gather as much money as they can to fund companies. And I have a startup in California as well. And it's what I'm doing with my startup. So you know what we are doing basically, it's to gather as much information as we can to build a round which is as big as we can. So that's the way it is nowadays. And but all what I can say as of now is that we know for sure we can count on our existing shareholder to build the next round. And obviously, as we speak, we are working on it. Do you think it's reasonable to assume you will need 200 million from here to 2027 to get to break even? So I think if you run the math on if you see our burn, I think yeah, that's a good assumption, and hopefully it will be less as well. So if you think that this company raised in excess of around 500 million euro since inception. I believe we raised more than 2/3 of what we needed. So I think from a financing standpoint, in the history of the company, we made the hard work. So hopefully now we are able to show data reassuring people and helping us to get there. But I think, Filippo, your assumption is hopefully the right one. You talk about searching for new fundings and said we should expect something soon. Are you in talks and close to signing a deal? When are you expecting the new funding? Well, you know, if you follow the company, we've been working like this for the last 2 years. It's not unusual, unfortunately, in France. It's pretty hard to get people around the table. So I think with what we have in our hands now, we are able to close a new round, and you should expect news very soon. Are you considering a business continuity plan? Yes, I mean, when you work in a startup, and it's true for all companies, because you never know. I mean, you know, as a manager, you need to plan for the worst. And I've been doing that for the last 7 years. So every time we prepare for a raise, we have a continuity plan as well. So it's nothing new under the sun. And, you know, I was watching my TV last night, and I was following Elon Musk, and you know, Tesla died nearly 10 times. That's the startup life. Has the supplying issue been completely solved now? So if I would say yes, I would be a liar, and I don't want to lie to people. What we said is we stabilized the supply chain, and we improved it to get to 10 products beyond a month. So clearly, there are still tiny open issues we are solving. New ones will come, and we are solving older ones. But as we speak, clearly we have a better grasp on the supply chain. That's no question. It's improving every day, and we are very confident by the end of the year we can ramp up in an easier way, if you will. So there are no other questions, if I'm not wrong. So thanks for your time, and thanks for your support and your trust. And see you very soon for additional news. Thank you very much. Have a good evening. Bye.